Every day, more healthcare teams are exploring how extended reality can improve patient care. We have seen it support pain and anxiety management, rehabilitation, engagement, and professional education. Extended reality, or XR, is a general term for technologies that change how we see and interact with the world by adding or replacing parts of reality with digital content. Despite growing evidence and technological progress, widespread clinical adoption remains uncommon. This is the XR valley of death. Promising pilots struggle to reach routine care, not because the technology fails, but because of workflow, training, resources, and organizational barriers, often identified only after implementation has begun. To avoid the XR valley of death, readiness must be assessed before major investment. The traditional approach is reactive: invest, run a pilot, and discover the barriers too late. A proactive approach identifies readiness gaps early, allowing the pilot to begin with the right conditions, responsibilities, and support already in place. The MCDA-XR framework is a pre-implementation governance tool designed to examine how a planned XR use case fits its real clinical context. It was developed through a mixed-method study combining evidence from 13 implementation studies with established perspectives on healthcare implementation, behavioral change, technology acceptance, and XR-specific safety and reporting. This process produced 10 criteria covering human, organizational, technical, safety, and governance factors. For each criterion, multidisciplinary stakeholders assess strategic importance, how critical the criterion is for the proposed use case; organizational readiness, how prepared the institution is to address it under real-life conditions. Crossing both scores reveals priority gaps where implementation barriers are most likely to emerge. This helps clinical teams and institutions act before deployment, strengthen weak areas, and design research protocols that explicitly evaluate the most relevant risks, constraints, and implementation conditions. The framework, therefore, does not simply decide whether to proceed. It shows what must be addressed for the XR use case to be feasible, safe, and sustainable. MCDA-XR has now been published in the Journal of Medical Internet Research. We chose JMIR because of its strong focus on digital health, implementation, and real-world healthcare innovation, which closely matches the purpose of this work. The paper describes how MCDA-XR and its dual importance readiness assessment were developed. Phase 3 is now applying the framework prospectively in real healthcare settings. So before your next XR project, don't just ask, "Can we do it?" Ask, "Are we ready?" Read the full paper in JMIR, and if your clinical team, university, or healthcare organization is planning an XR project, get in touch. We are actively looking for new collaborators to apply MCDA-XR in real-world settings.